Hello, I'm Sarah Meek, Managing Director of Mates in Mind charity. I hope you've had a really great session so far. And thank you very much for tuning in to watch this one. So Mates in Mind charity is a UK-based charity that works predominantly within construction, transport and logistics. And we work to break down the stigma, raise awareness of mental health in the workplace. So the session is going to be around the journey towards a mental health maturity model in the workplace. And I'm sure lots of you are already got in place within your organisations, perhaps initiatives or support around mental health. So hopefully this will work to enhance what you already have. Okay, so moving on. So what do we actually mean by mental health? Well, any one person at any time can be experiencing a variable amount of mental health. And the World Health Organization describes this as where you create a positive contribution to either your workplace, your family, or society. So that's when everything's working absolutely optimally. But as we know, things like how you traveled in the morning, bereavement, family stresses, how you're actually feeling in yourself in a physical capacity, all these things can have a really strong impact on your mental health. And the relationships, particularly at work and at home as well, mean that it's not one thing at any one time. It's absolutely on that continuum, on that right-hand side between good health and then sometimes veering towards poorer mental health. And then we also have 1 in 4 people who have a common mental health issue. So something like anxiety or depression, where, again, if you overlay some contributory factors on top of that, so financial worries, for example, it can really mean that, that your mental health can be impacted a little bit more than normal. And then we have mental illness, where that's 1 in 100 people, and that's where you're generally under the care of a hospital or a community health team for something like bipolar or schizophrenia. But for the purpose of this presentation, I'm going to be talking about the more short-term distress and those with a common mental health issue. So, as I say, there it is, the state of mental well-being that enables people to cope with stresses of life, to realise potential, and to learn, work well, and make a positive contribution to society. And that's absolutely where people are thriving, and that's where we would hope that we're going to be supporting you as organisations and as teams to make sure that is, commonplace. So when we look at the stats, and these are predominantly UK, so 7 million days were lost due to work-related stress, depression or anxiety in 21-22. So this is a big issue within the UK workplaces. And as we know, if people are feeling not themselves, then generally productivity might start to suffer as well. So it's really important that businesses look at what we can do to support people around mental health, because it's good for business as well as good for the individuals. And this equates to an average of 18.6 days lost per case. So you think about perhaps some of the smaller organisations, and this can have a significant impact on your capacity and on things like timescales for delivery. And stress, anxiety and depression account for 51% of all other work-related ill health cases. And within construction alone, in 2021, there were 507 suicides, which is nearly 4 times higher than any other industry. And we see this as well as being a higher risk sector within Australia, America, and recently Sweden is also starting to show that people within construction are starting to have mental health issues as well, and suicide. So 4 in 5 suicides are by men, and it's by far the biggest cause of death for men under the age of 35. And we know that there are particular times of the year where perhaps those contributory factors around financial flow, around relationships with family, can really start to have a negative impact. Interesting, drivers of forklift trucks had a suicide rate that was 85% higher than the national average. So this is something that isn't exclusive to somebody's job role or job sector. It can absolutely have an impact throughout a wide range of workplaces. And so what we have seen is that 2 in 3 UK tradespeople perhaps are starting to use drugs or alcohol as a way of actually coping mechanisms. How can I make this feeling go away? How can I make myself feel better? But sometimes, particularly around alcohol and drugs, that can actually exacerbate the situation and create more of an anxiety state. And what we see every day is that people don't feel comfortable disclosing mental health or any psychological conditions to their employers, very often because there's a fear of, potentially what it might mean for their job, whether they would be used on the next job, whether they would be seen differently, seen as less capable. But sometimes people who are coping with mental health conditions can be functioning really quite highly but internalizing a lot of this. And as we say, mental ill health costs employers in the private sector £45 billion annually. So we need to do something about this. And what's our self-employed research within construction shown us in the UK? Well, trades are found to have the highest levels of severe anxiety. So about a third of people are currently experiencing severe levels of anxiety. And reasons for those we see are that the workload is too high. There's a lack of control. Now, lack of control in terms of, where you're going to be sent next, what the timescales are, what the job is itself. Very often those decisions are made by others, perhaps further up the organisation, and there's that feeling of a lack of control. As I say, relationships with colleagues, financial pressure or increasing debt. And as I say, drinking more than normal and non-prescription drugs, but also self-harm. And that 40% of people not happy to talk to a colleague about mental health means that they're coping alone, and they're trying to work it through. And things like construction and other sectors, it's a very practical sector to work in, where you really try and be as resourceful yourself and find the solutions yourself, and are more likely actually to speak to friends or family than they are the people within the workplace. And that's why the work that we do is so important around giving people the competence and confidence to be able to have those conversations with those around them. So, as we say, these are generally where we see the top causes of stress and anxiety. The HSE, actually, the Health and Safety Executive in the UK, defines stress as the adverse reaction people have to excessive pressures or other types of demand placed on them, where workers feel stress when they can't cope with pressures and other issues. So there is a legal obligation, and I'll come on to that a little bit later. So what do we then see? Well, we see people, sleep is generally the first thing to be affected, where we have poor sleep leading to fatigue at work. And research has shown that the longer sleep is disturbed, the longer there is that insomnia. There is a direct correlation between having suicidal thoughts, if it continues, actually planning suicide, and then if it continues even further, completing suicide. So sleep is such a crucial point of mental health, and it's very often quite a good conversation opener with somebody who you might be concerned about. How are you sleeping? What's keeping you awake at night? Because as we know, that first question, how are you, is generally going to be met with, I'm fine. And it makes it difficult to then continue with that conversation. We also then see musculoskeletal conditions starting to come through, so back and neck or shoulder pain. And very often it's the reason that people will ring up if they're not going to be coming into work, that they'll put it down to musculoskeletal issues rather than admitting that they have a problem with mental health. It seems to be more acceptable to say that you have problems with your joints, back pain or an upset stomach, than actually saying that you are personally feeling a little bit challenged at the moment. We can also see things like increased irritability or short temper around people you're working with, headaches or migraines, and as I say, very few people, fewer than 1 in 5 will actually speak to their GP about it. And certainly post-COVID, with the lack of appointments in the UK, it is becoming something that you are even less likely to talk to a medical practitioner about. So how is this actually affecting the industries? Well, within construction, logistics, and rail, a recent report earlier this month showed the percentage of people planning on leaving their profession in the next 12 months due to stress or mental health related conditions. So it's 17% in construction, which, given the skills shortage that we have currently in the UK and in a lot of other countries, this is something where, we can't afford to lose people, and we need to attract people in. In logistics, it's looking at 19% and rail 12%. And the people who've taken time off due to unmanageable stress or mental health conditions in the past 12 months, you can see there 28% in construction, 27% in logistics, and 18% in rail. So these are people who have taken some time out, but actually, are they going back into the cycle where nothing's actually changed for them? If you speak up and you speak to somebody who can make a difference, rather than putting a sticking plaster on it and going back through that same cycle. I want to show you this video. Now, it does refer to suicide within it, and therefore, if this strikes a chord with anybody on this session, please look after yourself. And if you want to come back again in a little while, then do. This tells the story of our patron, Michelle, and her family. And Chris, unfortunately, ended his life through suicide. He'd worked in the construction industry for 30 years, and over a 3-month period, this tells his very sad spiral into mental health conditions. But it really resonates, and the family are very keen for us to show this as widely as possible.
But that was a good man. It's a hard question. What was it like?
He was a beautiful child. He was easy to talk to, very easy to talk to.
He loved football. He loved Chelsea.
I support Chelsea because of my dad.
Yeah, he was just a brilliant lad. I've got to say that, he was brilliant.
Everybody would say that he was so laid back. Like, so laid back, he was horizontal.
You know, he had a really good sense of humour. We did have a good laugh.
He worked in the construction for just over 30 years.
He was a great guy to work with, to be honest. He was a hell of a team player. He always had time as well.
He was one of the people that I probably aspired to be. So, no, he was key in my career, as well as being a mate.
And I do aspire to be like my dad.
The project he was working on was going into the next stage or phase of the construction.
He just changed his whole attitude. He just wasn't sleeping. He was so ill.
I went back to uni and I said, just keep me up to date. And I thought when I come back for Easter, he's going to be back to himself. And Easter came and it was horrendous.
He started to feel that he couldn't manage the workload.
Because he was in sort of our office at the time, and we sort of talked about it, and
Chris opened up to myself and Frank, and we were quite surprised how his demeanour had changed, and some of the things that he was taking on board, how it was affecting him. It wasn't the Chris we knew.
So I don't think he knew what was going on in his head, and I think he just wanted it to stop.
He just wasn't the same man. He wasn't. He was so stressed, so under pressure, so ill, because he would never have done what he did as the old Chris.
You never think this is going to happen because he's still dad and he's going to get through it, but he couldn't. It's okay.
Can't describe how much I loved him.
He's the only person, the only boy, but the only person probably as well, made me cry. And I cried.
You know, you don't expect to lose a child. It shouldn't happen. There's no description in losing a child. It should never happen.
Nobody saw it come in, really.
It was a shock, difficult to sort of like comprehend and to come to terms with, but real shock. Yeah, such a shame, such a waste.
Other families don't have to go through what we're going through. We'd like to save them from going through it so that mental health or stress within the workplace is dealt with.
With Dad, it was the stress that led him to not sleep. He was so worried, so consumed by the fact that he was going to lose his job, and he was never going to. It was the irrational thoughts that were coming.
If it could happen to Chris, that's the bit that doesn't compute with me. If it could happen to Chris, it could happen to anybody else as well.
If people can sort of understand it can happen to anybody.
If they feel that their workload is making them stressed at work and at home, and they're starting to feel that they can't manage it, please do approach someone. Just
to reach out before it gets too late, because obviously my family's experienced it and it's the worst thing anyone could ever experience.
An awareness or an awareness training will help, and it's much better to reach out to someone and find it was nothing you needed to do.
Companies need to be aware of what is happening, and the stress can kill. Does kill.
Because it was all so sudden, if it can happen to him, it can happen to anyone.
And that's without scaring people. I think it's a really important message, and that's why you should really ask for help. You're not a weak person. You're still the same person. Just need a bit of help along the way, you know?
Thank you for watching that, and hopefully the story of Chris, you might actually think about some people that you're worried about in your life, and do reach out and make sure that you are following up on any concerns that you do have. So when we think about where we thrive,
but that was a good man.
So when we think about where people actually thrive, and it's in that place of comfort and stretch. So it's good sometimes to have a little bit of stress. It motivates us, it inspires us to keep going. But where we see that curve continuing into that line of delusion, where you're starting to normalize those feelings, where you're thinking it's perfectly okay to be undergoing that level of stress that's increasing, that it's starting to eat into your home life, where you can't perhaps switch off on holidays, and you're checking your emails, you're checking them late at night, you're checking them early in the morning, and you're working over and above what is reasonably expected of you. That's where we start tipping into the strain and the crisis point. And sometimes that is a very difficult place to get back from. So we absolutely want people to be thriving, not just surviving. And that's so important, that when you have the opportunity to be talking to colleagues, to team members, when you have your one-to-ones, ask people, how they're managing, how's the workload, and make that part of a regular conversation, where people can actually open up if things are starting to become too much. As I say, that thriving, surviving area is where you've got calm, you've got steady mood, you've got consistent performance, ability to focus, and communicate and sleep. When it starts to go towards the right-hand side and we've got the struggling and in crisis, what we might then start, as I say, seeing is that we've got poor performance, difficulty making decisions, perhaps difficulty concentrating, and that's where those negative thoughts start to come in. So let's get as many people to that left-hand side as possible, and you all have a part to play in it. So the Health and Safety Executive in the UK have published their results in December 2021. And the two key statistics linked to work-related stress, depression and anxiety are that a number of workers suffering a new case of work-related stress, depression or anxiety rose 30% in 1 year. So this is something that we know the pandemic has had an impact on, but actually how are we doing now? What's going on in workplaces right now, particularly around financial pressures. It might be around supplies, it could be around workforce and capacity. So this is something that, again, stresses why we absolutely have to take this preventative, proactive approach to it, and not wait for people to reach a point of crisis. So when I talk about the maturity model within mental health, this is Mates in Mind, and as a charity, we've been working for the past 7 years supporting organisations to think about a really holistic end-to-end view of mental health in their organisation. So it absolutely comes from the top, and we're looking at leadership practices. How are you as leaders communicating mental health? How are you supporting it? How are you being those frontline ambassadors for mental health? And what do your practices sort of put onto people? So is it just words that, yes, we're supportive, but actually the working conditions and the working environment means that people aren't thriving? What's the culture? If we went out and asked members of the team, what's the culture around mental health? What would they be saying about you? And does it match that policy and that vision that you might have around the leadership team? What policies and procedures do you have? And do they actually come alive within the workplace? And how is that communicated? Rather than it always just being on set days throughout the year, so World Suicide Prevention Day or Stress Awareness Week, is this something that is there 52 weeks of the year where people who are challenged by mental health can feel that actually there is a care around them? The training and awareness, and this is really important, that it doesn't just sit with a few people within an organisation, but that it becomes everybody's business, that peer-to-peer support. We know that mental health first aid, England has really taken off within organisations, but just because you have that coloured lanyard, does that mean that you're the person that people are going to go to? Perhaps it is better that everybody has a degree of mental health awareness, and in particular that the managers, the line managers and the team leaders have got that extra level to know what they can do about it. We also provide professional support through counselling or access to financial support. And as I say, that line management is so key in what's going on. But let's make this inclusive. Let's also think about any apprentices or students that you've got coming through the business, the supply chain who aren't employed by you, but nevertheless will be coming through your doors and will be involved in your work. Let's make sure that everybody has got access to the same services, regardless of their organisation, because very often the smaller organisations won't have that commitment around a dedicated health and safety team or a dedicated HR team who can work on all of these things. So it'd be great if they can be given access to what's in place as well. And what does it all do? Well, it starts with an organisational assessment, an establishment of how are you doing right now, and then it's a set of questions that comes up with a list of recommendations, and then we work through it with you and support you through that process to make sure that we've got, as I say, a holistic end-to-end fantastic mature model that's not just about here's a helpline, here's an app, here's an employee assistance program or a mental health first aider. If people don't know how to use those things, if people are suspicious around the confidentiality, they're not going to use it. It has to absolutely be a step-by-step process to breaking down those barriers, but ideally to prevent people in the first place from reaching a point of crisis. So what can we do together to make this difference? Well, we're looking at prioritising mental health at work and having that degree of accountability. We're looking at positive design and work cultures. I can't emphasize enough how important a culture of an organization can be, and what would people be saying about you as an organization? Is it a place that they recommend? We also think about the promoting an open culture around mental health, having really positive role models there. It's great if people within your organization are happy to talk about their personal experience and not to say necessarily what others should do, but just to say that they also have had issues themselves, because it breaks down some of those barriers. To increase the confidence and capacity of all staff having the ability to talk about and start those conversations. And then providing the tools, so signposting, looking at those contributory factors, so something around financial well-being. We've got, you know, a fantastic team that will go and talk to the workforce about, you know, as much as it is around the emotional and mental health well-being, actually, how's your financial well-being as well? And then increasing that transparency and that accountability. How are you going to measure that within the organization to know that you've really made a difference? So as I say, the barriers to people seeking support are generally around the acknowledgement. They don't think that there's necessarily an issue. They've just normalized that it's perfectly okay to be doing all those hours and to have that level of stress. I've never seen a job description that says that work-related stress is part of a role, and where it starts to become out of kilter with what's acceptable and it's starting to interfere with sleep patterns, then something needs to be done. To break down that stigma, the perceived benefit, what's going to be the point if I talk about it? Nothing's going to happen. Well, actually, there's quite a lot that can happen once you've been brave enough to say that you are having a few challenges. The confidentiality aspect can also play quite a big role. Will people start to know within an organisation? Well, absolutely not. Employee assistance programmes won't be sharing levels of information. Mental health first aiders, unless there is a particular safeguarding concern, will not be sharing anything. And it's better to talk than it is to try and keep it into yourself. Okay. And so where do we have the things called psychosocial risks? So recent research by Deloitte showed that the cost of poor mental health is about £1,700 per employee. And yet for every pound spent, there was a £5 return on society if companies invest in good mental health support and proactive steps for their teams. So there's a really good return on that investment. The publication within the UK of ISO 45003 has introduced the term psychosocial risk. And this is sort of all the different hazards in the workplace to look at, to risk assess, and then to absolutely mitigate. So things like, for example, aspects of how your work is organized, examples of roles, control and autonomy, the social factors at work, where we've got interpersonal relationships, the leadership for people, the support and supervision, and that work environment, equipment and hazardous tasks. We need to think about mental health the same way that we do as general health and safety. You know, we wouldn't wait for an accident to happen and then think about whether we should do something about it or not. If you see a risk to something, you need to put in place the steps to stop it from happening. And this is exactly the same as for mental health. So it's not just a people thing. There is a legal duty, and this changes depending on where you are in the world. But certainly in the UK, there is a law that requires all employers to prevent work-related stress, to support good mental health in the workplace, and a legal duty to protect workers from stress at work by doing a risk assessment and acting upon it. Now, this is something that the Health and Safety Executive can come in at any time and ask to see your risk assessments. And actually, in different parts of the world, there are, for example, Canada, France, Denmark, Finland, Greece, and Sweden. It needs to be considered as part of an OSH legislation. And in Australia, Belgium, and Austria, they are required and need to involve psychosocial risk experts. So this is absolutely something that is so important. when you're thinking about how to embed it within your organization. And again, the completion of stress risk assessments and supporting you through it is something that we do with organizations. And also we have Peter Kelly as part of our team, who is fundamental in the HSE, working through those management standards, but also ISO 45003, and he's there available for any organization who's interested and wants to reach out to us to see how you're doing around compliance. So what are organizations doing? Well, we define these as tertiary, secondary, and primary. Tertiary is around the treatment, rehabilitation, that point of need, that point of support when somebody says, I've got a problem. And as I say, that's around the EAP, occupational health, mental health first aiders, and perhaps rehabilitation. So that's that support. We then have secondary, so that awareness piece, the promotion and the upskilling of all employees around stress management, risk training, and starting conversations. And then we have that primary prevention. How do we set ourselves up as a work organization around the quality and safety of the physical environment, the culture, and how workers feel about their work? And to be honest, we don't want people to reach a point of crisis. We want them to reach out earlier when there's things that can be done, much, much sooner before it takes a human toll on somebody. And where should we be putting 80% of our effort is in that primary and secondary piece to unlock the door to people seeking help earlier on. And so, question to you all, not for chat, but just to think and reflect upon, how do you measure the organizational impact of anything that you've put in place around mental health within your organization? How do you know it's making a difference? And what are you doing around that primary prevention and awareness piece? Let's not forget management, middle management in particular. They're very often what we call the squeezed middle. They need to have a degree of understanding in the role that they play, and to strengthen the softer skills, the actual sort of managing people. We often hear that people have risen through the ranks of management based on their technical abilities, their knowledge, their expertise, but perhaps there's been a lack of support and investment around management training for them. And yet they have a huge responsibility in leading teams, in the way that they come across, in the way that they are that frontline ambassador. And actually, how are they managing their own workload, and how does that then cascade down to others? And if you're working on complex projects, they're very often the ones who are managing people from different organizations and trying to make things work and balancing both resources along with the financial pressures as well. So that role of leaders in the mental health and stress awareness, what's the impact that they have on others? Is it a lottery every time there's a different project and people are moving on to a different set of individuals that they're working with? How is that going to have a degree of consistency throughout the organization? How do they set and maintain the culture? And then what's their role model? How are they? What's it like to be on the receiving end of a leader within the organization? What are the kind of the languages that are used around mental health? If it's things like, it's just the way we've always done it, or, man up, or, we don't talk about that kind of thing. All those things will close down conversations and make people think, I'm not sure if I should be disclosing that I'm struggling. There should be ambassadors for mental health and prioritize it amongst other things. We know that project delivery timescales are all important, but so is the welfare and well-being of somebody. Okay, and give people enough proactive opportunities to discuss how they're doing around workloads, around perhaps working away from home, how are they feeling, and to demonstrate that when you go away from the office and you're on leave or you're in weekends, what do your actions demonstrate to others? If you're sending emails, are you expecting an email back? Are you expecting a text message back? All these things will have an impact on the culture. And there is a report around mental health first aid being used as a tool for improving mental health and well-being. at the moment, there's a huge degree of bias in any reporting that's done around the success of it. So please don't just rely on mental health first aiders in the workplace. And if you do have them, how are you looking after them? How are you making sure that they are looked after themselves personally if they're having conversations? How are those anonymous themes being fed back into the organisation to stop others from facing similar difficulties? And also, as a team, how are they delivering a consistent level of service within your organisation? How are they selected? How are they, how are they engaged with and supported? So a really useful research article there, but that does not conclusively at the moment state that there is a significant impact from having that alone. And it's really, I saw this quote, and this is the power of vulnerability to create a connection and to lean into your own discomfort. Mental health is a difficult thing to talk about. It's very difficult as a leader as well, if you've had challenges yourself, to actually admit that you do. But leaning into that and showing that human side can have such a door-opening effect. So again, what do we do as a charity? Well, we've just been named in the suicide prevention strategy announced by the government, and that has been really important for us to be recognised in that way. And sorry, I'm just having a few issues with the slides here. And we campaign for change. In that campaigning for change, we are making sure that we are engaged with all aspects of the organisations that we work with and across the industry. So things like making sure that, sorry, I'm just struggling a little bit with that slide. That just doesn't seem to want to stay on there. So things like how do you work around payment terms? How do you, for example, work with the procurement frameworks? What do your contracts say around mental health? And how important is that from beginning to end? And it is absolutely a whole team approach. So how do you look after, for example, women in the workplace, particularly if they're in the minority, as we see within construction, transport and logistics? How are they feeling? Those little micro comments that are, perhaps said in a jokey, meant to be jokey way, actually can really start to penetrate when they're said regularly throughout a day, throughout a week, and make people feel less respected and less valued within an organisation. We've also got LGBTQIA+, and the impact of mental health within the workplace. How supported do they feel? What are the comments? What's the culture around supporting people from different communities? As I said before, the supply chain and making sure that everybody has got equal access to anything that's taking place. And, if you're holding, for example, toolbox talks, downtime sessions to talk about supply chain, recognize that they might not be paid for any downtime. Perhaps put that into a contract early and see that it's something that is factored in and they're included. This shows we were very fortunate recently to have a visit from His Royal Highness the Prince of Wales, and he was very interested in what the work we do and talking to people across the industry about the different factors that contribute to their mental health. And things like neurodiversity, certainly within construction, 1 in 3 people is expected these days to identify as neurodiverse. But actually, let's think about how that contributes to an organisation. So, for example, attention to detail, the real sort of strength that people from a neurodiverse background can bring to an organisation, but how do we make them feel included and their mental health supported? And when we say full inclusion, what we mean is, are your materials, are they mainly written in English? How do we, those 3 things that we've got there, we've got it in Romanian, Polish and Albanian, and we need to make people be aware of what's happening, so that a poster behind a toilet door, if it's not written in a language where people can identify, they're not going to know that support is there. So let's see what we can do to make people feel truly included. This is very odd. Okay, so just a few examples here of organizations we've worked with, and things that they've felt. Starting team meetings to address a conversation has broken down taboos, for example, around menopause, encouraging individuals to share their experiences and their own practical tips. What we realize, though, is that mental health is a one-size-fits-one. What works for one person isn't going to be the fix to someone else. But by giving people different opportunities, different coping strategies, you might find that it works for you. But please, whenever you're having conversations, avoid the this is what you should do, this is what I did, because that's not necessarily going to resonate with somebody who's opening up. They will have a different set of support and mechanisms to help them. Within Balfour Beatty, they've absolutely seen that positive cultural shift within the organisation. Everybody has got mental health awareness, and they feel that 94% of people felt they felt better cared for by the organisation. And they've seen a real positive change towards mental health in the workplace. And they really identify different groups within the organisation and how they can best support. And ADT, they saw the success of the program was in increasing annual leave. They updated the hybrid working. They looked at flexibility, and it has become absolutely part of what they do. And as I say, has really sort of come alive within the organisation. So just again, a time for personal reflection. Is there anyone in your team or even yourself that's showing signs of burnout or struggling with mental health? Anybody that you're concerned about? And what action do you need to take in starting that conversation with them? Don't wait till it's too late. If you're worried, and if you're still worried, ask them twice. So we've got some resources here in the UK that people can access. For us, we've got a text service, a free text service that's available to anybody, and it's text BM8 to 85258. It's available 24/7, 365 days of the year. It's an anonymous service because we know that people can sometimes struggle picking up a phone or speaking to somebody face to face. You've also got the money advice service, you've got the addiction services, and particularly within the UK, the B&C Construction Worker Helpline can offer both free counselling, but also financial support to people working within the industry. So as a charity, very often taking those conversations, getting people to really get to know each other within an organisation could be done through fundraising events, through being outside in nature, or just doing something crazy. And we're always happy to be the recipients of Charity of the Year, or a nominated charity, or even just fundraising, because for us it makes such a huge difference. We've got a really strong apprentice program, so we're starting to educate colleges and train up tutors to deliver mental health for people coming into the industries, because we want to stop this from happening. We want to absolutely tackle this from as many different angles as we can. And as I say, if anybody is interested in learning more about what we do, how we can support your organisation of any size, and we do have support available for smaller organisations, so do reach out, give us a call, and find out more about how we can help you, starting with that assessment, and then nudge working with you towards that really strong mental health maturity model. And that's it. Thank you. Thank you for listening, and I really hope that you enjoy the rest of your sessions, and I look forward to hearing from you. Thank you.